Hi everyone and welcome to today's episode. On today's Face Facts by Dr Yusra, I am talking all things skin peels, which is appropriate given I've just had a skin peel. You can see my skin is shedding like a snake and I am keeping it real. I've shared this journey on my Instagram and on my TikTok. So if you followed along, you will have seen my skin start to shed like a snake. And this is an incredible treatment. It's an underrated treatment known as a chemical peel. Now I'm going to talk you through what a chemical peel actually is and what it can do for your skin. Forget horror movie flaking and scary reactions. We are talking science-backed, medical-grade exfoliation that transforms your skin from meh to marvelous. This is like hitting the skin's reset button, but with a medical degree. So what's a skin peel? A skin peel is essentially a controlled chemical exfoliation that removes layers of damaged skin. It stimulates new cell growth and collagen production, and it's essentially a mini trauma that we do on purpose to boost repair and regeneration. Now, this is not based on my opinion, this is facts. This whole YouTube channel, the podcast is called Face Facts, and I want to cut out the BS that is out there that scares people because bad news makes news, right? When people think of skin peels, they often think of Sam from Sex and the City with her face burnt off, looking red, looking sore, and they get afraid. But that's not the reality. There's a whole range of different skin peels out there, from superficial peels, which we call no-peel peels. You peel your skin without actually physically shedding, unlike what I've had done, to medium depth peels where you physically shed, to very deep peels. I'm going to break down the different ingredients that can have different outcomes and where they are appropriate. Now, according to a review in the Journal of Clinical and Aesthetic Dermatology, chemical peels can significantly improve acne, they can improve melasma, hyperpigmentation, photoaging, and scarring. So yes, the science has our back and our face. So let's talk about the different types of peels. And let's start off with the most basic of peels. These are called superficial peels. These are the entry-level glow-up, but they are effective. And you do not have to have deep flaking peels where you're physically kind of shedding. You can have a peel that you can even use at home on a daily basis. And almost all of my patients are on some form of a chemical exfoliant or a liquid exfoliant, also a chemical peel, on a daily basis. Now, I don't want you to be afraid by the word chemical. Everything is a chemical. Your tea is a chemical. Water is a chemical. Every single thing is a chemical. What these are, they are liquids that we apply on the skin that penetrate into the skin at different depths to remove the dead layer of skin. And when we remove the dead layer of skin, what shows is glowing, healthy, bright, luminous, and radiant skin. Now, some of the most basic ingredients that you can use at home, depending on the percentage and what your clinician prescribes, is alpha hydroxy acids. Alpha hydroxy acids are a staple in the vast majority of my patients' skincare routines that they use to get rid of that dead skin cell to give them that glow. So these are ingredients like glycolic acid, lactic acid, and mandelic acid. It's clinically proven, and there's a study in the Dermatological Surgery Journal that showed 70% of glycolic acid, that percentage, can improve mild photoaging and skin texture over 6 sessions. Now, 70% is strong. That is not a do at home. That is a professional skin peel that you would have in your clinician's office or in their clinic. But you can use a low dose, like a 4% glycolic acid, on a regular basis at home. But of course, this depends on your skin type. If you're using it incorrectly at the wrong pH or inappropriately because it's not suited to your skin, you can damage the skin barrier. So don't go out buying acids over the counter that might not suit your skin type and that might result in an impaired barrier function. Always start off with having a consultation with a skin expert who can guide you after assessing your skin type. Now let's talk about lactic acid. Lactic acid has been proven in multiple trials, and this has been around since Queen of the Nile. Nefertiti, Queen of the Nile, used to use lactic acid. She used to take milk and use that as part of her exfoliation and part of her skincare regime to increase hydration and reduce pigmentation. It used to give her brighter skin. And so we use lactic acid, which has, again, been clinically proven time and time again. There's another study in the International Journal of Cosmetic Science that has shown that lactic acid at various different concentrations can help to brighten the skin. It's a superficial type of skin peel. It's a peel that is gentle on even the most sensitive skin. So this is the type of ingredient that I would choose for patients who might have sensitivity, who might be a little bit dry, who might be a little bit irritated, but need a little bit of brightening. Now, there's also azelaic acid and there's also mandelic acid. Now, these two ingredients are fantastic for patients with skin of color. Azelaic acid can be used again at home on prescription from anywhere between 15 to 20%. You can get it over the counter at 10%. My preference is 15% because it hits and it does what it needs to do. And I think 10% is generally too weak to actually show much difference. So what does this particular acid do? It's a great one because it's actually fine and safe in patients who are pregnant. And I have a lot of pregnant patients. I've been pregnant and breastfeeding for about 6 years. Okay, I've had 3 kids. That's 3 pregnancies, 3 children that I breastfed till about 1.5 years. So a heck of a lot of my life in the last decade of making babies and feeding babies. And it's really frustrating when you can't use much of the clinically proven medical grade skincare out there. But azelaic acid is one of those things that you can. It is proven to be safe and it treats a wide range of different conditions, including acne, post-inflammatory hyperpigmentation, post-inflammatory erythema, which is redness. So it's a great daily liquid exfoliant that you can add into your skincare regime that can help to brighten your skin and keep pathologies and inflammation at bay. It can also be used to treat redness. So patients who are generally quite red or sensitive, it's a great peel for them. Now, in clinic, we do use these peels, and one of my favorites is called the Azilan peel by Mesostatic. This is a very strong azelaic acid quantity or percentage that we use for patients who have rosacea or who have redness or who have sensitivity or who have acne and they want to exfoliate their skin without irritating it and without an extreme amount of peeling or without visible shedding like this. The Azilan is fantastic for that, and that is an azelaic acid-based peel. Now, what about mandelic acid? Mandelic acid is also generally thought of as a superficial peel. So this particular peel is an ingredient, mandelic acid is an ingredient that is very large in its molecular weight. So it's a large molecule and it penetrates very slowly. And that means that it's safe on skin of color. And we can use 20, 30, even 40%. Fantastic for patients who have hyperpigmentation, who are skin of color. So patients who might be my color or darker. And it's very important that in patients of skin of color, we are taking exceptional care about placing medium depth or very deep peels on them because they are more intense and they can cause a little bit more shedding and have a higher risk of complications. So let's talk about medium depth peels. So medium depth peels are those peels that go to the deeper layer. They might go to the basement membrane, which is the junction between the epidermis and the dermis, or deeper. So if you think of a superficial peel as a peel that targets the epidermis, which is the outer layer of the skin, that's the kind of peel that we use on anyone that has surface texture issues. They might have large pores, they might have acne, they might have inflammation, they might have excess oils, and they want to resurface their skin. A superficial peel is great for redness, post-inflammatory hyperpigmentation, post-inflammatory erythema or redness, acne, oil, texture, and pores. But if we want to go a little bit deeper and we want to target fine lines and we want to target pigmentation, then we need to get into the deeper layer of the skin known as the dermis. So the first layer of the skin is the epidermis. You then have something called the basement membrane. We can put a picture here. And then you have your dermis. And the dermis is divided into the papillary dermis and the reticular dermis. The reticular dermis is deeper. The papillary dermis is the more superficial aspect. And when we're talking about medium depth peels, we are talking about the chemical exfoliant penetrating past the epidermis into the dermal layer. And the dermal layer is where you have your fibroblasts, which are the cells that make collagen, that make elastin, that make extracellular matrix. This is where you also start to get degradation of collagen as you are aging, which results in fine lines, wrinkles, and you also have your melanocytes, the cells that produce pigmentation. And you have keratinocytes, skin cells that might have pigments in them. And so if we want to shed the skin, if we want to have a deeper resurfacing, if we want to give you a little bit more of a textural improvement in the microarchitecture of the skin, then we need to do a medium depth peel. So what type of ingredients are they? We're talking about TCA, trichloroacetic acid, or a combination of peels including TCA. So in a journal called the International Journal of Dermatology, in a 2004 study, TCA peels showed significant improvement in melasma, which is chronic hyperpigmentation in the dermal layer, especially in darker skin types, but you have to use it with caution. So you got to go to someone who understands skin of color. Unfortunately, many of the studies out there haven't been conducted properly on patients with skin of color. And many clinicians do not have experience with patients of skin of color. And skin of color is not just black skin, it's also Arab skin, it's also Asian skin. And there's very small amounts of literature and data and knowledge and expertise and discussion about Arab skin, Asian skin, Pakistani skin, Indian skin, a lot of conversations happening about black skin, Chinese skin in Asia, but not very much about Arab skin. And it's important to understand that the deposition of melanocytes is different in each skin type. There is a whole range of phenotypes, which means different types of skin, that is beyond the traditional scale that we have been taught as clinicians, which is called the Fitzpatrick Skin Scale, which basically denotes that everybody fits into one of 6 categories. You're either very white with light eyes, light hair, and that's called Fitzpatrick skin type 1, and it goes up to Fitzpatrick skin type 6, which is black Afro-Caribbean skin, which is thicker, that is more prone to post-inflammatory hyperpigmentation if you do deep skin peels on them. But there's a range in between, and actually that's a very simplistic scale. We now know that there is a much larger variety, hundreds of different skin types. So skin of color in particular is a high-risk category, and that is anybody with Mediterranean background, Asian background. Even if your skin is lighter, but you have the genetics of coming from someone in your family line who is Mediterranean, Asian, Arab, or Afro-Caribbean, your skin may react differently because of the genetics and the phenotype. So it's important that you discuss that with the clinician doing a skin peel. Do not just go in, even if you're very light-skinned, have a conversation if you have a mixed genotype, because that does put you at higher risk. Now, when you have skin of color, can you have a medium-depth skin peel? I am living proof that you absolutely can. I am skin of color. I have dark hair, darker eyes, darker skin, and I pigment or tan in the sun. I don't burn. So I am a Fitzpatrick 4, okay, which is known as a patient of skin of color. Can I have a deep skin peel? Yes. Is there more risk when I have a skin peel or from treating a patient like me or darker than me? Yes. But how do we do this safely? You absolutely have to prepare your skin beforehand. And the skin preparation, also known as skin prep, involves treating the skin with pigment suppressors called tyrosinase inhibitors, so that when we do a skin peel like this, you shed, you look like a snake for 5 days, and then you glow. And that is the aim. But certainly, it's important to have a consultation beforehand. Now, can you use TCA? TCA is fantastic. Trichloroacetic acid is a medium-depth peel designed to come in various different percentages from 10, 20, 30, even 40%, and it can go up to 100% TCA. Now, the only time people will be using 100% TCA is in very isolated areas like an acne scar, where we are essentially creating a full-depth burn to the skin. And we do that in patients who have acne scars, who have something called ice pick scars. So you can literally get a toothpick and drop the TCA into the ice pick scars to cause a burn and then contraction. It's high risk. And that's a conversation for later. But know that TCA comes in a range of percentages, and know that not all percentages are suitable for all skin types. So 10% is relatively safe. And you can combine it with a lot of other ingredients. There's a peel called Jesner's peel. There's also a peel called the Perfect Peel. And these peels combine trichloroacetic acid, TCA, with a range of different ingredients. That might be salicylic acid. Salicylic acid is a beta hydroxy acid. This is a fantastic skin peel that can be used superficially. It can be used as a superficial skin peel alone at 20%, or it can be combined with TCA to carry it in deeper. Now, a beta hydroxy acid is different to an alpha hydroxy acid, and that a beta hydroxy acid is oil soluble. It's pore loving. It gets right into the gunk and it breaks it up. So it's fantastic for acne lesions. It's fantastic for patients who have a lot of oil on their skin, or those with lots of congested blackheads and pores. And scientific evidence has shown that using salicylic acid on a regular basis, or using it as a skin peel can reduce acne lesions by 40 to 60%. That's significant. And therefore, often we do a salicylic acid peel for acne patients as a superficial peel once a month for 6 months, because salicylic acid also comes from a very well-known drug called aspirin. And aspirin is anti-inflammatory. So remember that salicylic acid is pore-loving, it's oil-loving, it gets into the gunk, but alpha hydroxy acids don't do that. So if you've got acne, if you've got oil, if you've got congested pores, you can use salicylic acid on a daily basis at a percentage of about 2%, or you can go into clinic and have a salicylic acid peel to reduce the inflammation on the skin and reduce acne lesions, pores, blackheads, congestion, etc. at a much higher percentage of 20% or more. Or you can combine it with a TCA to take it even deeper. Now let's talk about deep peels, because deep peels is a serious business and it's really only for those truly committed to major transformations. Now the ingredient that everybody's talking about is a phenol peel. Phenol peels are incredibly effective for deep wrinkles, for sun damage, with results lasting up to 10 years. So this is huge. This is very, very transformational. But the downtime is real and the risks are seriously concerning. A phenol peel should not be done by anybody except a medically qualified practitioner. It carries significant risk of hyperpigmentation, scarring because of burns, and even, unfortunately, cardiac arrhythmias and death. And there have been deaths reported with phenol peels where patients had them in clinics where their heart rate was not being monitored because of the type of peel that this is. And because of the anesthetic that's often used, patients can have cardiac arrhythmias. And therefore, this should only be conducted where your heart is being monitored in order to prevent death. So health comes before vanity. Phenol peels are very, very profound. They can show significant transformational impacts. They have profound dermal remodeling with significant neocollagenesis. This has been proven time and time again in various different studies, but it's not one without risk. And I would certainly not be jumping into a phenol peel without first trying a superficial peel, a medium depth peel before going deep. I would even say try a deep peel with a stronger TCA, like a 40% TCA, if appropriate, before going to a phenol peel, because of the risk to health and life with a phenol peel if conducted inappropriately. So let's nerd out for a moment and let's talk about what actually happens during a peel. So when we put these acids on the skin, what they do is they break the corneocyte desmosomes. These are essentially the glue that holds the dead skin cells together. And because we break up this glue, that results in exfoliation of the surface of the skin. Now, that also results in a trigger to the skin to start turning over faster. So again, it's like hitting the refresh button on a cellular level. It stimulates the fibroblasts, those cells that lay down new collagen in the dermis. And that means they start producing new collagen and elastin. And again, there have been multiple studies showing this. They found that combination ingredients where we combine TCA peels, which is a medium depth peel, with a glycolic acid, which is an alpha hydroxy acid, with a salicylic acid, even with a retinol, peels significantly increase dermal thickness and collagen density over time. So those who don't understand how peel works will tell you, oh, but a peel will thin the skin. That is total utter BS. It's nonsense. It's not true. That's not how it works. Peels get rid of the dead skin cells. At the same time, they cause dermal remodeling. They induce neocollagenesis, which means you're going to see surface texture improvement. You're going to see an improvement in pores. You're going to see an improvement in fine lines and wrinkles. You're going to see an improvement in the evenness of your skin tone. And one of the most aging things is an uneven skin tone. If you have patchy hyperpigmentation, if you have open pores, if you have lines and wrinkles in the skin, if your skin is lackluster, it's not radiant, it's not shining, it looks dead because, hey guys, the dead skin cells sit there on the surface and they clog up the upper layer of the skin. They don't reflect light. They don't have any what we call cytoplasm. They don't have a nucleus. They're dead. They need to go. If they sit there, then when the light or the sun is coming on the skin, they're not reflecting, they're absorbing. So your skin looks meh, looks dead, it looks unalive, it looks just unhydrated and it looks aged. So when we resurface the skin and you bring all those new skin cells to the surface, suddenly they're radiant, they're shiny, you've got this glass-like skin. And this is the most underrated treatment in medical aesthetics. Now let's talk about the OG of alpha hydroxy acid, which is glycolic acid. This is a very tiny molecule. It penetrates very fast. It's actually a sugar molecule. It comes from sugarcane. And again, multiple studies have shown that regular glycolic acid peels improve skin roughness, fine lines, and even early actinic keratosis. Now let's talk about glycolic acid because there's a lot of misinformation out there. A lot of people think glycolic acid is not suitable for skin of color. Let me tell you that that is based on opinion. It is fictional. It is not fact. Factually, every single study that has been done has shown that glycolic acid can be used in patients with skin of color, even Fitzpatrick skin type 4, on 5 and 6, on a regular basis. So you can use anywhere between 2, 4, even 5% glycolic acid on a regular basis at home under the supervision of a clinician. And this helps to improve skin quality, skin texture, skin tone, and skin surface evenness in patients of all skin types and colors. You can have in-clinic peels with glycolic acid anywhere from 5, 7, 10, and 20% or more, depending on your skin thickness and what you're trying to treat in patients of all skin types and colors. But it's important, again, that the right peel is chosen for the right patient. Now, let's talk about the ingredient lactic acid. This is a milk-based acid. It's very hydrating. It's very gentle. And we actually use this in our clinic on a regular basis. We have a treatment in clinic called the hydrofacial. And part of our 6-step treatment is a skin peel for every patient that involves a combination of glycolic acid, salicylic acid, and lactic acid. So we're using a combination of different ingredients to resurface the skin and break up the glue that holds dead skin cells together to hydrate the skin, to nourish the skin, to resurface the skin, and to stimulate the skin. Now, lactic acid peels have been proven not only to improve hydration and not only to exfoliate, but they increase something called ceramides. Ceramides are, think of them like a protection. They improve the skin barrier. They're the glue between the cells. They help to keep your skin hydrated, and they are placed in a lot of moisturizers. Ceramides are part of the building blocks of healthy skin, and you need a good amount of ceramides in the skin for a good barrier function. You also find ceramides in skincare like Alpha-Ret in the evening, which is an added ingredient to hydrate. So they're often combined with humectants, which are hydrators. Mandelic acid, another very common acid that you can get in a daily skincare product. We use this in a lot of our mesostatic products for patients who have hyperpigmentation. These are fantastic because they're slow acting, they're large molecules, so they're ideal for rosacea-prone skin or darker skin tones that are very, very safe and effective. Studies have shown that mandelic acid reduces acne and pigmentation with minimal irritation. So that's the ingredient that you want if you're skin of color with irritated skin, or you just don't want to have actual shedding or peeling, but you want to resurface your skin. Now, salicylic acid is the OG of pore purification. It is the go-to ingredient if you've got pores, blackheads, congestion, etc. It's a very efficacious ingredient, and it's great in comedones and also in inflammatory acne. TCA, trichloroacetic acid, it's versatile, it's powerful, it comes in a various range of different strengths. Clinical trials have shown it's efficacious in treating pigmentation, acne scarring, and fine lines. So that is my go-to. I have a TCA peel like this where I'm literally physically shedding. Follow my journey on Instagram for that. I put a highlight on my Instagram, Dr Yusra Al-Mukhtar, so you can see what it looks like over the course of 5 days. I am on day 4 today, and I do have some visible peeling over here, but the rest of the skin has started to come through. TCA is one of those, I think, underused ingredients because people don't know how to use them. But in the right percentage for the right patient, this really packs a punch for the ultimate spring clean. I like to have this done around March, April every year, at least once a year, to just spring clean my face, pay my taxes, start fresh, and I love to go into summer feeling nice and clean because in the summer, I don't like to wear a lot of makeup. I like to wear my skin. I want to get rid of all of the gunk, and TCA is the ingredient for that. You can have a TCA peel done more regularly, so it doesn't have to be a one-off. It can be once a month for about 3 months. So it's a great ingredient, something that I recommend in my patients at least once a year, if not 1 to 3 times a year, depending on what we're trying to treat. It can also be a nice finishing touch if you're treating hyperpigmentation as well. Sometimes after treating melasma or chloasma or post-inflammatory acne or post-inflammatory redness, we just need to coagulate the upper layer, the vascularity that is left behind. We want to resurface, we want to even the skin tone. TCA is the one. Now, I have combined my peel, which I did on 4 days ago, which was a 10% TCA with salicylic acid, lactic acid, glycolic acid, with one of the most utilized, most studied ingredients called retinoic acid or retinol. Retinoic acid is a vitamin A derivative. It's technically not a peel, but it's used in combination treatments. And there are multiple clinical studies that show that retinoids increase epidermal turnover. They reduce mottled pigmentation significantly, and they increase the amount of collagen you have in your skin. So why do we combine it? We combine it because when we're resurfacing the skin, we want to stimulate new collagen to come to the surface. Now, you can use a 1% retinol, 2, 3, 4, 5. And if you're a medical grade, if you're using medical grade peels or you're a medical professional, then I like to combine it with 6%, which packs a punch. But hey, go hard or go home. If you're going to peel, peel well. And I have combined my peel with a 6% retinol that I applied twice. So what this has done is it's given that boost. I've peeled faster, which means I'm shedding quicker so I can get back to my normal life routine faster. But also I'm getting a boost of new plump skin. I've peeled even my lips to give it more hydration, more luminosity, more skin surface evenness. So you can see it's a little bit dry here. It's a little bit dry above my upper lip. This is normal. And this tends to finish shedding around day 7. So why peel at all? I guess that's the major question. Why not just stick to microneedling or stick to injectables? Well, injectables are volume replacers, and microneedling will stimulate collagen, but they're not going to get rid of dead skin. So if you want brighter, smoother, more even skin tone, I have to say a peel is my go-to. I also use this as my first line measure. So in patients who are going to start a big skincare regime or who have a lot of acne, they've got pigmentation, they have fine lines, and I want to stimulate, I want to wake up the skin. The skin has been sleeping, it's dead, it's dull, it's lackluster, it has no life to it. I want to get rid of all that dead skin cells. I want my ingredients in my skincare that I'm prescribing to my patients to work more effectively. But if the skincare has to penetrate through layers and layers and layers of gunk and dead skin that has sat there for ages, then it's not going to be as efficacious. So if I can get rid of that dead skin, then the skincare is going to penetrate deeper and we're going to get a much better result. So I use this to increase collagen production, to increase elasticity, to increase hydration, to increase glow. And who doesn't want to glow? Everything that everyone wants nowadays, you can see all over TikTok, all over YouTube, people want to look like a dolphin. The hashtag dolphin skin has over 6 million views. So apparently we all want to look like sexy fish. I think if you want to have a skin glow, this is the go-to. You can choose the depth of peel that suits you. I would say, look at what your skin issue is. Don't just use all ingredients. Think of your peels as your skin's personal trainer, right? We are trying to resurface. It might sting a little bit when you first have it, depending on what ingredient, but that's very short-lived. Know that you are building strength, you're building resilience underneath, and these are scientifically backed by clinical data, time and time and time again. So let's recap what the evidence says. Glycolic acid peels improve texture and photo damage in 4 to 6 treatments. Usually you can have this done once a month. TCA shows marked improvement in melasma and scarring in fine lines and wrinkles. Salicylic acid, my go-to for anyone who has acne lesions or inflammation. Mandelic acid, fantastic for patients with skin of color, works gently but effectively for pigmentation and sensitivity. Azelaic acid, wonderful for rosacea, absolutely great for patients who have any kind of redness to their skin or pigmentation, and even in pregnancy. Phenol peels, transformative, but absolutely only for those ready for a proper skin sabbatical, because there's downtime. These aren't fads. These are the real deal. They do come with risk. And I would say you need to go and find a dermatologist who knows exactly what they're doing when it comes to phenol peels. But all of these peels are backed by decades of dermatological research and peer-reviewed studies. So again, fact, not fiction. Don't follow trends. Follow scientific evidence. This is why we have called this Face Facts, because we want to break down all of the misinformation out there and bring you real-time scientific evidence on how you can optimize your skin health with proven treatments or proven ingredients. So whether you're a skincare rookie or a seasoned glow getter, chemical peels are one of the most powerful tools in the medical aesthetic toolkit when done properly, professionally, and based on your skin's needs. That's why I have one every single year. I've had one every year for at least a decade. I have one of these medium depth peels. And I love it, and I'll keep doing it. And in fact, I'm already planning my next one. I'm either going to be doing a skin peel next month, or I'll be having a CO2 laser. So you'll be seeing me on your screens looking peely or red again. I love to stimulate my skin, and the time to do it is anywhere between autumn to spring. Summertime, you don't want to resurface your skin, because if you're resurfacing or peeling the outer layer, your skin can be more sun sensitive. So bear that in mind when planning your skincare journey. If you want me to do a deep dive on which peel is right for which skin type, or show you some behind the scenes of a real peel treatment, hit like, follow, and subscribe. Remember, your skin doesn't need a filter, it just needs clinically proven formulas. Love you and leave you till next time. See you later.